Hello, ladies and gentlemen. Welcome to the genetic presentation on the genetic disorder Isovaleric Acidemia. A brief history of isovaleric acidemia. This genetic disorder was discovered by Dr. K. Tanaka in 1966. The condition is sometimes referred to as IVA or sweaty foot syndrome. It is considered a rare genetic disorder, affecting approximately 1 out of every 250,000 births. Additionally, this disorder does not appear to affect a specific region or area. For the remainder of the presentation, I will refer to isovaleric acidemia as IVA. So, what is IVA? Patients with this disorder are unable to break down the amino acid known as leucine. Proteins essentially are the building blocks of our body and how it functions. They are responsible for all the growth and repair that occurs throughout our lifetime. When this protein does not function properly, or this amino acid is not able to be broken down, this can cause problems for the individual. So the result is this buildup of organic acid within the body. IVA is classified as an organic acid disorder because of this. If the levels of this organic acid reach abnormal levels in the blood or urine, this can result in serious health threats to the person. So what are some of the associated characteristics and symptoms of IVA? An important thing to note is the physical effects or symptoms of this disorder are not the same for every individual. Some individuals will have more frequent or severe symptoms compared to others. Additionally, some symptoms can appear within the first few days to weeks after birth. Some of these symptoms include poor feeding and loss of appetite, weight loss, and development of a unique odor around the feet, hence the nickname sweaty feet or sweat foot. Additionally, in some cases, individuals will experience what is known as a metabolic crisis. This involves symptoms such as lack of energy, vomiting, breathing difficulties, and feeling irritable, along with some other symptoms such as seizures in rare cases. These can appear later in early childhood and can be triggered by infections or illnesses. So, the molecular cause of IVA. IVA is caused by a mutation of the IVD gene. The IVD gene provides instructions for making an enzyme that plays an important role in breaking down proteins obtained from our person's diet, specifically the amino acid leucine that we mentioned earlier in the presentation. Leucine is part of many amino acid chains or protein structures in our body. So, as we mentioned earlier, this condition is a genetic disorder. It is genetically inherited. So how is this? So the condition is inherited via an autosomal recessive pattern. This means 2 copies of the mutated gene must be present in order for the offspring to be affected. In other words, both parents must possess the mutated gene for the child to be affected. If only one parent has the affected gene, it is possible for the child to be a carrier of the trait, but they will not be affected by it. Here is a simple example of a pedigree of inheritance pattern. Please note the individuals in red are affected by the disorder. The ones in blue are classified as carriers. So remember, in order for someone to be a carrier, they only need 1 copy of the mutated IVD gene. In order for them to be affected and the disorder to manifest itself, in this case, both parents must possess the mutated IVD gene. And as mentioned earlier, there is no specific ethnic group, region, or area that this genetic disorder is found in or is more prevalent. So even in the pedigrees, you can see a little bit of diversity in the generations. So that is one interesting thing to note about IV. So some of your genetic testing options. So IVA is traditionally tested via blood sample, and this is the preferred method for diagnostic purposes. Testing can also be done using urine samples, which is the second most popular, or skin samples. These are often used to help determine possible carriers of the disorder. Testing for IVA is provided in every state, and many states, such as Texas, for example, have it included in the newborn screening panel of disorders that are automatically tested on newborn babies. So when your baby is born, there is a set of tests that they are automatically screened for. IVA is one of those tests in the case of the state of Texas. Testing is typically done at the newborn stage or early childhood if signs begin to manifest. As I mentioned earlier, it is provided in newborn screenings. You can also go to various testing sites and get it done at your own discretion or desire, with the cost of that ranging anywhere from $250 to $500. So the potential life-threatening effects. Early testing is vital to avoid any life-threatening effects. So we mentioned earlier that the buildup of these organic acids can be dangerous if they approach toxic levels. And the reason is it can result in permanent brain damage or even death within the first few years of life. So treatment and management of this genetic disorder. Like most inherited genetic disorders, there is no actual cure for the disorder itself, but it needs to be managed. In this case, it will require lifelong management. And in many cases, it is easily managed and the individuals live, relatively normal, fulfilled lives. The main way it is treated is done via diet restrictions. So some of the common foods that individuals with IVA need to be mindful of include milk, dairy, eggs, nuts, peanuts, butter, and fish. Fruits and vegetables can be consumed in measured amounts with minimal issues. If you have IVA, you will be treated not only by your physician and related healthcare providers, but you will likely have a nutritionist and dietary individuals who will help you and educate you on what amounts of food you need to be eating and what foods you need to avoid, or how much of certain foods you can consume before it potentially leads to issues. In other instances, medication and supplements may be used to offset some of the nutrients an individual may not be getting. The medication is kind of on a case-by-case basis. So these will vary based on the symptoms present and in the cases of metabolic crisis that we mentioned earlier. So individuals who may suffer from seizures or have a sudden drop in glucose or something like that, your treating physician will counterbalance that with specific medications or combinations of medications and supplements. This will vary depending on the patient's symptoms and the needs and wishes of the family. So finally, to close this presentation, this condition is very rare, but it still has various support groups and related resources. Some of the following are listed here. Your Organic Acidemia Association is probably the most prominent, along with Any Baby Can of San Antonio Incorporated, SPAWN Parent Advocacy Network, and Baby's First Test. These websites and groups provide support for individuals who may have a child with IVA, as well as additional resources, information, list of healthcare providers and clinics who specialize in the disorder, and it is a great place if you are seeking further information or have further questions. And finally, here are some of the references that I used to put this presentation together. And as always, if you have any questions or concerns, please do not hesitate to reach out to me. I thank you for your time and attention. Have a nice evening.